Recognizing the symptoms of osteoporosis. When to see a doctor, osteoporosis causes bones to become fragile and prone to fracture. However, this progressive silent disease often has no obvious symptoms in its early stages. Bone loss typically occurs over many years before a broken bone alerts someone to the presence of weakened bones. Knowing the signs of advanced osteoporosis can help guide appropriate medical care. This article outlines the symptoms and warning signs that indicate it's time to get evaluated for possible osteoporosis. Introduction. Osteoporosis is a common bone disease affecting roughly 10 million Americans. It happens when bone breakdown exceeds bone building, leading to decreased bone density and strength. The gradual bone loss that characterizes osteoporosis usually produces no clear symptoms for a long time. Osteoporotic bones fracture easily from minor stresses that normally would not cause breaks. Fractures often arise from simple motions like bending over, lifting light objects, or even sneezing or coughing. The wrist, hip, and spine have high susceptibility to osteoporotic fractures. Recognizing symptoms of advanced osteoporosis. Since osteoporosis develops slowly without symptoms, many people don't know they have thinning bones until a fracture occurs. Warning signs of advanced bone loss include fractures from minimal trauma. Fracturing a bone from a minor fall or accident points to underlying osteoporosis. The most concerning breaks are hip, spine, and wrist fractures. Height loss. Spinal fractures from osteoporosis cause a stooped posture and height loss over time. Losing more than 1.5 inches after age 50 warrants medical evaluation. Back pain. Chronic lower back pain or pain between shoulder blades results from vertebral compression fractures and spinal osteoarthritis. Tooth loss. Osteoporosis also causes bone loss in the jaw. Loose teeth and tooth loss often coincide with osteoporosis. Kyphosis. A stooped, rounded upper back is called kyphosis. Multiple vertebral fractures cause this convex curvature of the thoracic spine. Weak, less flexible muscles. Advancing osteoporosis leads to weaker, stiffer muscles around fragile bones. Symptoms requiring urgent medical attention. While concerning, the general osteoporosis symptoms above rarely constitute emergencies. However, certain symptoms should prompt immediate medical evaluation. Severe, sudden pain, acute onset of very severe, debilitating muscle or bone pain could indicate a fracture requiring prompt treatment. Major trauma, any significant injury like a hard fall, necessitates immediate medical assessment to check for possible fractures. Loss of function. Inability to move a limb or get up after a fall warrants calling 911, as it may signify a broken bone. Numbness, tingling. Numbness in the legs, buttocks, or genital region can result from spinal cord compression following vertebral fractures. Seeking same-day medical care for these red flag symptoms can facilitate rapid treatment for any fractures and avoid potentially permanent complications from osteoporotic breaks. When to visit the doctor. Many people wonder at what point they should make a doctor's appointment to get evaluated for possible osteoporosis. Reasons to request an initial bone health evaluation include family history of osteoporotic fractures, long-term oral steroid treatment, unexplained chronic back pain, early onset menopause, menopause transition, age 50-plus years. Screening tests like dual energy X-ray absorptiometry, DEXA, scans help detect osteoporosis before debilitating fractures occur. Early treatment increases bone strength and reduces fracture risk. Conclusion. Osteoporosis is considered a silent disease because bone loss is invisible. However, recognizing subtle symptoms helps identify advanced osteoporosis requiring medical treatment. Sudden, severe bone pain and fractures necessitate emergency care. But most symptoms first warrant making an appointment with a primary care doctor or bone health specialist for diagnostic testing. They can determine if osteoporosis is present and start medication well before fractures develop. References: National Osteoporosis Foundation. What is osteoporosis? Medline Plus, osteoporosis. Cleveland Clinic, osteoporosis. Johns Hopkins Medicine, osteoporosis signs and symptoms.